Today is World AIDS Day. This year's theme is It's in Our Hands to End HIV and TB. Deputy President Cyril Ramaphosa will be delivering the keynote address at Davidton in Ekurhuleni. While the main national commemoration is taking place there, the day is being marked across the country in different provinces. The South African National AIDS Council, SANAC, says South Africans must come together to empower young women in order to fight the rate of new infections among young people. SANAC says HIV prevalence among females is nearly 4 times higher than in their male counterparts. The first National CD4 or viral load monitoring dashboard was launched last week. It's an online tool that monitors CD4 count and viral load in South Africa's HIV positive patients. Viral load is the best predictor of a patient's response to treatment. Earlier we spoke to Health Minister Dr. Motsoaledi from our Pretoria studios. He gave us an update on the fight against HIV and AIDS in the country.
This is World AIDS Day, where we usually come together to reflect and also map the way forward. We usually give statistics of what's happening. We give the plans that exist around the country and around the world. We issue statistics and we encourage people that the end to HIV, AIDS and TB is in sight. That is why the theme for this year is it is in our hands to end HIV, AIDS and TB.
Mm-hmm. It's in our hands, but if it's in our hands, what does the fight look like currently as we speak, Minister, against HIV, AIDS?
Elvis, as you know, a fact which was repeated many times at the International AIDS Society Conference held in Durban here in South Africa in July this year, the theme that keeps upcoming is that we've been successful, you know, on the biomedical treatment of HIV. The biomedical part has been going very well. We are running the biggest treatment program in the world, 3.4 million people in South Africa alone, which is 20% of the global program. Our biggest weakness is the socio-behavioral part of it. That means the prevention, how people behave towards HIV and AIDS, and preventing it even before they get infected. That's why the Deputy President, Cyril Ramaphosa, who is the chairperson of South African National AIDS Council, launched a program called Whole Society, Whole Government Program, which is targeting girls in the age group 15 to 24 years, because research has shown that the rate of infection in that age group is still very high and is marching forward.
15 to 24, is that the most vulnerable group that we have in our society, Minister?
Yes, the girls and young women in the age groups between 18 to 24 are the most vulnerable. As I said, research has been done in Southern and Eastern African countries, which found that in those 14 countries, the rate of HIV infection among girls between 15 and 24 years is at the rate of 55,000 new infections per week. Mm-hmm. And half of that is occurring in South Africa. So we have got to pay special attention to that group.
Now, last week, the first National CD4 viral load monitoring dashboard was launched, an online monitoring tool. How will this assist us in the fight against HIV and AIDS?
Well, if you could remember, Elvis, in 2014, at the International AIDS Society Conference, which was then held in Melbourne, in Australia, we adopted the concept of 90-90-90, meaning we've got to find and test 90% of people who are HIV positive, and 90 those who are found to be positive must be put on treatment, and 90% of those who are on treatment must be virally suppressed. Now, once you reach that stage of viral suppression, you can declare that HIV/AIDS is over because it's no longer being propagated. Now, you cannot do that. You cannot declare that people are, their viral load is down unless you measure the viral load. You cannot, you cannot declare that somebody is virally suppressed unless you have measured their viral load. And this means measuring the viral load of each and every person who is on ARVs. And that's how big the job is going to be.
The LGBTI community, they want their own clinics because they say they still face challenges when they go to normal clinics. And they want their own clinics. And the question is, would government consider something like that, that is separate from the normal clinics for LGBTI community specifically?
Well, special clinics are important. And in fact, Elvis, when we were in Durban during the International AIDS Society Conference, I visited Prince Mushieni Hospital with Sir Elton John, because Sir Elton John has funded the establishment of special clinic for the LGBT at Prince Mushieni Hospital, and it's working very well. It's specially funded by him, and I'm sure you'll understand the reason, where the LGBT can go and relax and share and receive their treatment. It is a desirable thing because we are intending to do the same thing for adolescents, what we call adolescents-friendly clinics. Because, these are special type of people who are called key populations, who are specifically more affected by this particular pandemic more than other people in the general population.